are antibiotics? Antibiotics comes from the Greek anti, which means against, and bios means life. An antibiotic is a drug that kills or slows the growth of bacteria. Antibiotics are chemicals produced by or derived from microorganisms. Antibiotics are among the most frequently prescribed medications in modern medicine. Antibiotics are used to treat many different bacterial infections. Antibiotics cure disease by killing or injuring bacteria. Bacteria are simple one-celled organisms that can be found all around us. They are a natural and needed part of life. Bacteria cause disease and infection when they are able to gain access to more vulnerable parts of the body and multiply rapidly. Some antibiotics are bactericidal, meaning that they work by killing bacteria. Other antibiotics are bacteriostatic, meaning that they work by stopping bacteria multiplying. Some antibiotics can be used to treat a wide range of infections and are known as broad-spectrum antibiotics. Others are only effective against a few types of bacteria and are called narrow-spectrum antibiotics. Antibiotics classification. Although there are several classification schemes for antibiotics based on bacterial spectrum, antibiotics with a structural class will generally have similar patterns of effectiveness. Most commonly used types of antibiotics are aminoglycosides, penicillins, fluoroquinolones, cephalosporins, macrolides, and tetracyclines. Penicillins. The penicillins are the oldest class of antibiotics. Penicillins have a common chemical structure which they share with the cephalosporins. Penicillins are generally bactericidal, inhibiting formation of the bacterial cell wall. Penicillins are used to treat skin infections, dental infections, ear infections, respiratory tract infections, urinary tract infections, and gonorrhea. Cephalosporins. Cephalosporins have a mechanism of action identical to that of the penicillins. Like the penicillins, cephalosporins have a beta-lactam ring structure that interferes with synthesis of the bacterial cell wall, and so are bactericidal. Cephalosporins are used to treat pneumonia, strep throat, staph infections, tonsillitis, bronchitis, otitis media, various types of skin infections, gonorrhea, and urinary tract infections. Cephalosporin antibiotics are also commonly used for surgical prophylaxis. Fluoroquinolones. Fluoroquinolones are the newest class of antibiotics. Fluoroquinolones belong to the family of antibiotics called quinolones. Newer fluoroquinolones are broad-spectrum bactericidal drugs that are chemically unrelated to the penicillins or the cephalosporins. Fluoroquinolones can be administered not only intravenously but orally as well. Fluoroquinolones are used to treat urinary tract infections, skin infections, and respiratory tract infections. Tetracyclines. Tetracyclines got their name because they share a chemical structure that has 4 rings. Tetracycline antibiotics are broad-spectrum bacteriostatic agents and work by inhibiting the bacterial protein synthesis. Tetracyclines are used in the treatment of infections of the respiratory tract, sinuses, middle ear, urinary tract, skin, and intestines. Macrolides. Macrolides are bacteriostatic, binding with bacterial ribosomes to inhibit protein synthesis. Macrolide antibiotics are used to treat respiratory tract infections, genital, gastrointestinal tract, and skin infections. Aminoglycosides. Aminoglycoside antibiotics are used to treat infections caused by gram-negative bacteria. Aminoglycosides may be used along with penicillins or cephalosporins to give a two-pronged attack on the bacteria. Aminoglycosides are bacteriostatic. They work by inhibiting the bacterial protein synthesis, thereby inhibiting their growth. Antibiotic resistance. Antibiotics are extremely important in medicine, but unfortunately, bacteria are capable of developing resistance to them. Antibiotic resistant bacteria are germs that are not killed by commonly used antibiotics. When bacteria are exposed to the same antibiotics over and over, the bacteria can change and are no longer affected by the drug. Bacteria have a number of ways how they become antibiotic resistant. They possess an internal mechanism of changing their structure so the antibiotic no longer works. They develop ways to inactivate or neutralize the antibiotic. Also, bacteria can transfer the genes coding for antibiotic resistance between them, making it possible for bacteria never exposed to an antibiotic to acquire resistance from those which have. The problem of antibiotic resistance is worsened when antibiotics are used to treat disorders in which they have no efficacy, and when they are used widely as prophylaxis rather than treatment. Resistance to antibiotics poses a serious and growing problem because some infectious diseases are becoming more difficult to treat. Resistant bacteria do not respond to the antibiotics and continue to cause infections.
So here's our last message for you guys. Antibiotic resistance is a threat to humanity. Proper usage of antibiotics and knowledge to the topic are the key for a better future. For more information, feel free to ask your pharmacist.